In a powerful response to the escalating food crisis in Nigeria's northeast, the federal government, in partnership with the United Nations and other key stakeholders, has launched a vital 6-month plan aimed at saving millions from hunger, with projections showing that over 4.6 million people could face acute food insecurity this lean season. Minister of Humanitarian Affairs, Professor Nentawe Yewalda, emphasized the urgency of the situation. This is not just a plan, it is a call for conscience, collaboration and coordinated action, he stated, underscoring the moral imperative that no child should go hungry in a world with enough food for all.
Therefore, it's not just a humanitarian issue, it is a moral issue. A deep thought by all of us. It is a challenge, the promise that all of us need to make. It is a test of our capacity to act, knowing it is convenient, but when it is necessary. Today, we launch a multi-sectoral plan that brings together support for food assistance, for nutrition, for health, for water and sanitation, for protection, for agriculture, and for early recovery, all the poor within the Bay States. It's very important for us to note. Because no single sector can fix hunger. It goes beyond individual, and that's why all of us are still here in different capacity. And no single intervention can break the cycle of crisis. It needs a wholesome response from all of us.
The lean season food security and nutrition crisis plan seeks $159.3 million to provide life-saving assistance, including food, healthcare, nutrition, sanitation, and livelihood support for 2 million of the most vulnerable. UN Humanitarian Coordinator Mr. Mohamed Fall warned that over 1 million children under 5 face life-threatening malnutrition, an issue exacerbated by severe funding shortages. We are at risk of losing the ability to save lives, he said.
The humanitarian movement is under significant threat. Solidarity is in short of supply, and we see that lack of resources are putting millions of lives at risk. And unfortunately, many of those lives are children, and whose life can't be just lost and we standing around the roadside and watching. We hope that we can act fast. We hope also that we can together, despite all the challenges, continue to contribute to save life, reduce vulnerability, and also support those who struggle all day long. Across Nigeria, over 30 million people are at risk of facing acute food insecurity. Many are mothers who are forced to forego meals to feed their children, family forced to flee conflict, people grappling with poverty. In the Borno, Yobe, Adamawa state alone, we estimate, as you have seen in the video, 4.6 million people could be acutely food insecure during this upcoming lean season.
While Adamawa State Governor Amadu Finitri spoke of hardships worsened by armed groups, he vowed to continue supporting humanitarian efforts.
Where urgent relief and recovery assistance is required. This year, an estimated 1.3 million people in the state are projected to face severe hunger during the peak of the lean season, June to August, if immediate and coordinated action is not taken. The worsening food and nutrition crisis is driven primarily by insecurity, recurrent flooding, and prolonged dry spells. This year, over 4.6 million people across Borno, Adamawa, and Yobe State will face crises or emergency levels of food insecurity. In Adamawa, thousands of households are affected, and many children under the age of 5 at risk of acute malnutrition. Compounding this challenge is a sharp decline in humanitarian funding. critical services, particularly in health and nutrition, are being scaled back, yet we must not allow fatigue or resources gaps to cost lives. In Adamawa, we continue to invest in infrastructure, food security, social protection, and early recovery through expanded irrigation, health outreach, and livelihood support to displaced and host communities.
Similarly, Dr. Goje Mohammed from Yobe State described the hunger crisis as a growing tragedy.
Disproportionately affecting our children. Projection indicates that 4.6 million people across Borno, Adamawa, and Yobe states will face crisis or emergency level of food insecurity. In Yobe alone, 1.5 million individuals are at risk of severe hunger during the peak of the lean season. Without immediate coordinated action across the region, over 2.6 million children under 5 are expected to suffer from acute malnutrition.
UNICEF's Judith Lovely called malnutrition a preventable crisis, revealing that over 10 million children in Nigeria suffer from severe acute malnutrition.
As we enter the lean season, over 600,000 children across the Bay States will need nutrition services, of which 300,000 will need urgent life-saving services. Without these services, they will face imminent death. Evidence show that a child with severe acute malnutrition is 12 times more likely to die than any other healthy child. This is therefore not just a nutrition crisis. It is about child survival. And it's about child survival. It is a child survival emergency. So access to adequate nutrition is a fundamental right of every child as enshrined in the Convention on the Rights of the Child. And each one of us in this room is a custodian of that right. So to everyone here today, partners, donors, government officials, humanitarian workers, I implore each and every one of you and me to prioritize urgent action. Let us respond to the warning signs now before it is too late.
Tron Jason from the UN Office for the Coordination of Humanitarian Affairs stressed the urgency.
Those who have the most urgent needs. So again, as was said, this is very, very time sensitive. When it comes to transparency and accountability, we have systems in place in terms of both identifying the most vulnerable people, but also in terms of how things are being delivered, so that we track every single naira that is being used for the response. That's not just a requirement from our donors, it's a requirement from the government of Nigeria,